Well, a new report is calling on the Ford government to do more about the dire staffing situation in Ontario hospitals, saying implementing a nurse-to-patient ratio can not only save lives, but improve patient care. Dr. Jim Brophy, one of the researchers and co-authors of the study, joins me now live to break it all down. Dr. Brophy, it's a pleasure to have you in studio.
Thank you very much for having me.
You've got the report in your hands. And before
it's hot.
Before we delve into the findings, paint a picture for us. What are staffing ratios like right now in Ontario hospitals? You know, like how many patients is the average nurse in Ontario being assigned currently?
Well, it varies from department to department and hospital to hospital, but Ontario has the lowest patient to nurse ratio in the whole country. Our funding is the lowest of any province per person. We have, a dire crisis going on among nurses. This is the fifth report. I did 4 studies, academic studies, over the last 8 years, looking at the working conditions that nurses and other healthcare workers are facing, and it's dire. Survey after survey shows, for instance, in Ontario, almost half the nurses are thinking of leaving the profession, and we have an enormous retention problem. We are going to need something like 33,000 new nurses within the next 2 years, and half the nurses are thinking they don't want to be there anymore. And the stories that they tell us, the anxiety, the moral injury they feel that they're not able to do their job because the amount of patients that they have to cover, the workloads that they're facing, is actually challenging their professionalism and their deep commitment, to our care.
33,000 nurses over the next few years the province needs. What would it take to get there and to be able to implement an efficient nurse-to-patient ratio where it would actually be effective in our hospitals?
Well, I think, we can point to some really important lessons from other jurisdictions. The first really nurse-to-patient ratio legislation was passed in California about 20 years ago. And then in Australia, in 2 states in Australia 10 years ago. And both those jurisdictions show that where you have this, not only do you decrease patient mortality, the length of stay, the drop in hospital-acquired infections, the return, the readmittance, all of that, plus saving millions of dollars. And one of the major things in Australia, as an example, after they passed this legislation, 7,000 nurses returned to the bedside. They had refused to go there any longer under those conditions. So now British Columbia has passed this legislation. And in Nova Scotia, although it's not legislation, it's through the contract, they have these minimum nurse-patient ratios. So it's starting to catch fire across the country, so to speak, because the nurses, every time that they're polled, they're talking about the deep crisis they're in, the levels of burnout, the desire to leave the profession, their inability to do the jobs that they want to do. So I think that the pressure is building. And I should mention also that Manitoba now has a committee that's studying this, and hopefully this year they're going to issue their report. So the momentum is there, and it saves millions of dollars besides saving thousands of people's lives.
Yeah, you've kind of hinted at it here, but can I ask you, based on the evidence, how implementing a nurse-to-patient ratio addresses the full scope of the nursing shortage in this province and its underlying issues, which remain, being able to attract and retain nurses?
Well, especially among younger nurses, they are absolutely refusing to put up with these conditions. I mean, interviews that we did, for instance, a nurse coming off the elevator in the morning bursts into tears because she doesn't know how many patients she has. She knows she won't have a break. She's afraid that somebody's medications won't be given. So the anxiety, the moral distress that people are facing is enormous. So I think that if we start to do this, we will follow in the footsteps of Australia and other places, and nurses will start to come back to the profession. They'll start to see what's going on. I mean, now, any given day, they don't know how many patients they're going to have. And for every additional patient, there's an increased risk of mortality. So that fear that somehow the person you're caring for could be harmed because you weren't able to get to that person is an enormous burden for these people that are so committed to their work.
I have about 30 seconds left, but based on what you found, was there anything that stood out to you that was perhaps surprising?
Well, I think, first of all, how graphic. Over 100 studies have been done globally that show that the increase in the staffing and the ratio of nurses to patients will have a profound effect on not only the well-being of the nurses, but also on the patients. And it also, one of the surprising things is it saves enormous amounts of money. The readmissions, which are very high in Canada, higher in Ontario, are eliminated, or I shouldn't say eliminated, are reduced because of this increase in care.
Okay, Dr. Brophy, I have to leave it there. I'm out of time. Thank you so much for sharing your research with us this morning. Appreciate it.
Thank you very much for having me.